Good morning. This is Dr.SDير الراوي, the Director of the Oncology Center in Alzahra and Hospital in Alzahra Dubai. Today we are going to talk about the continuity of the series of thyroid surgery in Dubai and in Middle East. One of the major complications we face in these cases is that during the surgery we're losing signals with the recurrent laryngeal nerve, whether unilateral or bilateral, and we're using the NIM stimulator. This is about a problem usually happen about 5 to 10% of the cases, and difficulty sometimes, and doctor get panic or the surgeon. However, reassurance of the surgeon not to get panic about these cases is very important, because once you get panic in the middle of these cases, you will get trouble, and that trouble will really take the benefit of the surgery and do more complication. The most important problem that usually you get loss of the signal with the NIM stimulator is stretching on the nerve while you're dissection, especially if the nerve going through the gland, or previously there is a thyroiditis that the nerve is intermingled with the gland. Just need a proper dissection of the nerve. If the nerve looks intact, that's very most important. Stop the surgery and put some normal saline and sit for 1 to 2 minutes. Having normal saline and the electrolyte, the normal saline, it's very important to rejuvenate the activity in the nerve and the conduction. So that's what happened in the last time, which is in the operation. It took us 1 to 2 minutes. Let the anesthesia check the endotracheal tube positioning. Check the machine also, it's very important. 99% of the cases will recover. You don't need to get panicky about it, especially if the nerve is under your direct vision and you haven't injured the nerve. However, if there is an injury to the nerve, please call for the help in order just to re-suturing of the nerve. We are here all the time in the Middle East. We are available all the time to help you in these cases. And the most important, do not do any heroic things unnecessarily that cause more bleeding and cause more damage. This problem happened twice or 3 times the last 2 years for us, and we really managed to save it, and the patient was discharged home next day. Be sure that the voice of the patient and the recovery is normal, and don't get panicky about it, even if it's mild hoarseness, because this is some stretch and nerve pyrexia that can happen from stretching of the procedure. Try to keep your technique in handling the nerve is perfectly intact. So this is what you need to do, and you need to be patient, and this is our experience with the thousands of the thyroid that we have done in order just to keep them intact and the nerve intact, and to do a perfect surgery. Thank you. This is Dr. Alrawi from Heart of Dubai and Alzahra Cancer Center. Thank you.